Hello and welcome to the CDO Magazine interview series. I'm Dave Mariani, CTO founder of Atscale, and we're partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. And today I have the pleasure of talking with Omer Awan, Chief Data and Digital Officer for Atrium Health. Omar, you have a pretty amazing background in the healthcare industry. You've been part of that industry for quite some time now. So great to meet you, first of all, and would love just to sort of kick off our podcast with telling listeners a little bit more about yourself, and what was your path into the healthcare industry, and really just what was your path to how you got to where you are today.
My path into the healthcare industry actually was by accident. Initially, I was going towards a path into accounting, and it just so happened during the days we used to have campus recruiting in full swing, and Cerner Corporation, which is one of the large EHR companies, came to the campus, and they were taking many of the students for a tour to Kansas City. And so next thing you know is I went to Kansas City, took a tour, and they offered a job. And I was really fascinated by what technology could do in the healthcare space. So all along while I was doing my accounting, I thought you could do phenomenal things with technology and automate so much of the accounting rules and processes. But when I saw that what could be done in healthcare, I was literally floored. So ever since I've been in healthcare, different organizations, I've been on the vendor side, but as I mentioned with Cerner, but then with client sites with organizations like Memorial Hermann Healthcare System in Houston, Texas, and Northern Light Healthcare System in Maine. And then I was the CIO for Navicent Health, which became a part of Atrium Health about a couple of years ago. So that made my transition into Charlotte, into my current role as Chief Data and Digital Officer here.
It's like it's interesting background. I also don't have a college education really in technology. I was also accounting. I was econ business at UCLA, which was the business part was accounting. So how did you? I know what my path was. It was just happened to luck out and join a company that was working in technology. It sounds like you kind of had a similar path, but you obviously went to technology quickly. And have never looked back. So how did you learn those skills, coming from a background based on finance and accounting?
After completing my undergrad in accounting, well, the path originally was to, take the CPA exam and be an accountant. But then onwards, then I did my post-graduation in software engineering. Business administration. So I pursued that career path to really equip myself with some of the principles of software so that I could bring those to fruition. So that's how it went from there.
Got it. So, so healthcare is like, and you're an expert in healthcare, obviously. What are some of the difference, Omar, that you've seen with when it comes to data in healthcare versus maybe some other types of industries that we know?
So data is data, I think, regardless of the industry. So many of the principles I notice that apply to, or the policies and strategies that apply to outside of healthcare to data are applicable here in the healthcare realm as well. It just has a few more dimensions to it. That you have to be aware of. So the HIPAA privacy rule, when the patients come to our hospitals, they look upon us as the custodians of their patient data. So we have a responsibility to bring all safeguards in place, make sure that their data is safe. At the same time, we want to do all the analytical analysis on the data to make sure that we take patient care to the next level, and the consumer experience or the patient experience is phenomenal. So those are the similarities there. But at the same time, some of the advancements that are happening in the data space outside of healthcare are much more ahead of healthcare. So that way it kind of helps us in healthcare to look upon other industries. So for instance, if you look at the AI, ML evolution that's happening across, healthcare is still a laggard in that space. But then it makes it easy for us to look into see what's happening in the banking or retail or oil and gas and see what advancements are happening there and trying to replicate those cases in healthcare.
Yeah, so obviously, data privacy has always been sort of king, and in healthcare. So that's definitely true. Although, it's like where healthcare used to have at least in my view, I've spent a lot of time in finance and retail, and digital, and healthcare always had that reputation for sort of being a laggard. But it seems like times have changed, where the healthcare industry really is doing some cutting edge things that they're no longer a laggard, really, like right up there with finance in terms of being some of a pioneer in some new technologies.
Correct. So you're absolutely right. So a lot of focus is now on the healthcare side of this stuff. I mean, all of the bright minds in the data and digital space, they saw in a clear gap to zero in. And I think that has helped all the consulting organizations, consulting groups, and organizations, healthcare organizations. They have really plummeted themselves into what they can do. And they have definitely come a long way. I mean, we still have a long ways to go, but you're right, it's not where it used to be. Some of the advancements that are happening today in the healthcare industry with data are phenomenal. I mean, they're game changers.
Yeah.
But yeah, so we have definitely come a long way, but the promise remains there. I mean, I think we still have so much more that we can do that we haven't. Well, I mean, we'll get there soon, but it's really a territory to be explored.
Yeah, you think about just the possibilities with machine learning and all that data, and helping deliver better outcomes. There's a lot of potential there. So it's a very exciting time. So let's just talk a little bit about leadership and your leadership. So can you talk a little bit about the data culture and the concept of sort of data ownership in most healthcare organizations? Something you should know a lot about.
Yeah, absolutely. So I think that data in healthcare organizations, is complex and it's intensive because data drives information and information drives outcomes. But in healthcare, that impacts patient care. So more importantly, healthcare organizations are increasingly becoming data driven. At the same time, the exponential growth of data requires really a revolution in the way we manage our data assets. And to bring about data culture in a healthcare organization, data really has to be viewed as a strategic asset. And this has to be supported not just on paper, but via actions, top down.
Mm-hmm.
And so one of the things that I've noticed is that in small to mid-sized healthcare organizations, you may find like a centralized data analytics team that is looked upon to meet the data needs of the organization. However, in large organizations like ours, this model is not sustainable. And you have to elevate the data literacy of the organization by really implementing an analytics community model. So something like a hub and spoke model. And you really do this, and I'm oversimplifying it, but you do this by providing curated layer of data and tools to the departments and service lines so they can fish for their own data and work with the primary data teams for more complex requests. And what I've also noticed is that the complexity of the data increases obviously with the size of the organization and as the number of data sources grow. And therefore, it's important to really have a robust data governance in place to really avoid what I may refer to as data chaos. And because, in healthcare, every bit of data matters and really makes up the patient journey. So unlike other industries, in healthcare, inaccurate data does not simply mean wrong ETA or less than perfect retail or banking experience. It impacts human lives. So in an organization with mature data governance practices, all data assets, policies, competencies, and skills are continuously tracked and managed. And so that's what I think.
Yeah, the whole concept of hub and spoke model is one I want to drill down a little bit about, because it's also been I see that in our retail clients, actually, that kind of a model. And there's been a lot of talk about data mesh, which is sort of along that same lines of a decentralization of analytics, where there might be a central team to pick tools and the like, and set policies, but the business is in charge of creating data products. Can you talk a little bit about what your view is of like how talk a little bit to the listeners here about how an organization can really implement a hub and spoke type of a model for analytics?
So as I mentioned before, that it really goes back to, it's the starting point is to really have an inventory of your skills, of your data skills across the organization. And this is hard work and easier said than done, but someone has to do it. So if you're trying to bring about a different culture and you're trying to propagate this analytics community, you have to know what you're working with. And where are your teammates? Where do they stand when it comes to data literacy? Are they like novice or beginning users? They can do dashboards, just pull some reports, so they're pretty much middle of the road where they can develop some models or logic or really advanced analytics. Where do they stand? So that once you have that, a good inventory of the skill set or the competencies of your, then you can bring about these communities, foster these communities, so that you are not the only person, only team that is propagating or really elevating the data literacy, but they're learning from each other. You try to bring them together. The role of, in our case, the role of the hub is really to make sure that they have access to that data that they can work with, and the tools that you referred to, David, making sure that you have a standardized set of tools available to them, because you also don't want to get caught in a situation where different service lines and different departments have their own set of tools, and support becomes an issue. So, but then when you're developing these tools, that consensus is important, and these analytics community have a voice in forward the data maturity and in terms of what tools do we select. So it's a very collaborative process working together and elevating that.
So Omar, where does the hub live? Is that in IT, or where does the hub live for your organization?
So in our organization, the hub of data analytics is part of the IT. So we refer to our IT as IS, Information and Analytics Services. So it's part of that. But we completely understand that also, although it resides within the IT constructs, it's very much operates very closely with all the clinical and business leaders. So it's kind of a very democratic process as well. It's very much more aligned with the clinical, business, and strategic users, as well as with IT.
Yeah, I really like that model. I think we're going to see a lot more of it. It's sort of, we kind of, the pendulum swung back, we started out with all IT owning everything, even delivery and the creation of the reports and dashboards, to the business doing it all by themselves. And those are like two ends of the spectrum that are just really too extreme. You got the business owning everything, you got chaos, you got inconsistency, lack of trust. When IT owns everything, they become a bottleneck. So I think it's a really good model to sort of be able to deliver the best of both worlds.
Absolutely. And it becomes very, especially when, it's not sustainable. There's that, we have all been in situations where you always have more data requests than you have the resources. So the demand also always far exceeds your capacity. That's always been the case everywhere. But you also notice that just keep on adding more and more resources to your hub doesn't always really get you what you want. So that's why it's really, like you said, it's to have a hybrid solution, which is hub and spoke, really beefing those up together. That's I think the only way to go forward.
So Omar, this has been a great conversation. I want to thank you for joining me today. And to the audience, please visit cdomagazine.tech for some additional interviews. Thank you, Omar.
Thank you so much.